Flagellate dermatitis due to bleomycin. Metoprolol plus verapamil can cause bradycardia and heart block. Aplasia cutis congenita, scab defect seen with carbimazole intake in first trimester of pregnancy. Lithium toxicity, tenesmus, severe diarrhea, ataxia. SSRI side effect, sexual dysfunction. UMN lesion, weakness and spasticity. Fasciculation seen in UMN type lesions. Bulbar paralysis, LMN lesion, paralysis of cranial nerve 9 to 12. Pyramidal tract lesion, Babinski sign positive, spasticity, increased deep tendon reflex. Extrapyramidal tract lesion, involuntary movement lesions. Dermatitis artifacta, psychocutaneous disorder. Neurocysticercosis, cyst with a dot sign. Ring enhancing lesion of brain. NCC, GBM, toxoplasmosis, abscess. Epsilon aminocarboxylic acid, fibrinolytic antidote. TCA side effect, dry mouth, blurred vision, constipation. Keratin pearl, squamous cell carcinoma. Unilateral calf edema with erythema, deep vein thrombosis. Cannonball metastasis, choriocarcinoma. Granular muddy brown cast, acute tubular necrosis. Albert hereditary osteodystrophy, shortened fourth and fifth digits. Left gastric artery, branch of celiac trunk. Right gastric artery, branch of hepatic artery. Extrinsic involvement of stomach, parasympathetic through vagus, sympathetic through celiac plexus. Hypertrophic pyloric stenosis, surgery, Fred Ramstead pyloromyotomy. Erythromycin in early pregnancy, risk hypertrophic pyloric stenosis. Double bubble appearance, duodenal obstruction. Duodenostomy, surgical approach in duodenal atresia, stenosis, annular pancreas. Overhanging mucosa in gastric ulcer. Hampton's line, duodenal ulcer. Hunger pain, pain decreases after food. Total ergotomy and pyloroplasty, bleeding duodenal ulcer. Thrombohemorrhagic disease, DIC. Obstetric causes, placenta preterine, dead fetus, amniotic fluid embolism. Primary event, widespread thrombi. Secondary event, bleeding. Vascular occlusion, microangiopathic hemolytic anemia develops cystocyte. Vascular occlusion, ischemic damage to organs. Plasmin activation leads fibrinogen breakdown, D-dimer formation. Meningosemia, adrenal hemorrhage, Waterhouse-Frederick syndrome. Most primary lymphomas arise in MALT, mucosa-associated lymphoid tissue. MALT-associated chronic H. pylori infection. Non-Hodgkin lymphoma B cell type, most common primary gastric lymphoma. Primary lymphoma commonest site, gastric antrum. CHOP plus rituximab chemotherapy regimen. Surgical indication, gastric lymphoma, bleeding, obstruction, perforation, residual disease after CR. GIST, most common mesenchymal tumor of GI. GIST origin, interstitial cells of Ajal. Most common GIST site, stomach. GIST treatment, imatinib, a tyrosine kinase inhibitor. GIST metastasize, hematogenous route. Colon cancer risk, diet high in animal fat. Fish consumption increases risk, cause anti-cancer activity of omega-3 fatty acids. Almost all CA colon adenocarcinoma. CA right side of colon, fungating cauliflower-like growth. CA left side of colon, stenosing activity, variety. Obstructing lesion, right colon, treatment, resection and ileocholic anastomosis. Obstructing lesion of left side, treatment, resection of lesion and proximal diversion, Hartmann procedure. Resectable lesion treatment, diversion with colostomy or sigmoidostomy. CA level, marker of recurrence of colorectal carcinoma after surgery. Investigation of choice, CCT for staging. Acute intestinal obstruction. Three main clinical features: intestinal colic, vomiting, distension. Upper small bowel obstruction, vomiting increase, distension decrease. Absolute constipation beyond 24 hours. Obstruction associated with diarrhea. Mesenteric vascular obstruction, Research hernia, pelvic abscess associated with obstruction by adhesion. Gentle flickering of abdominal wall, visual peristalsis. Auscultation shows borbigamy is diagnostic. Silent abdomen suggests paralytic ileus. Gas shadows, supine position, fluid levels, erect position. Acute interception, palpation of a lump which is curved, sausage shaped and in line with colon, concavity towards umbilicus. Acute interception common, 6 to 12 months of age. Sudden onset, child screams in abdominal pain, draws his leg up. Vomiting often late, distension is absent. Blood with mucus, later stage. RCJ stool, red currant jelly stool. Emptiness in right left fossa, Signy D dance. Volvulus of sigmoid colon, middle-aged or elderly males suffer. Volvulus of cecum, 20 to 30 years old. Meconium ileus, infants with abnormal inspissated meconium. Intestinal obstruction due to worms, Ascaris lumbricoides. Gallstone ileus, obese women 40 to 50 years. PCOS gene involvement, dysregulation of CYP11A gene, insulin receptor gene or chromosome on chromosome 19p13.2, elevated LH, hypertrophy of theca cells with more androgen production, BMI less than 25, improve menstrual disorder, infertility, impaired GT, hyperandrogenemia. COC treats endometrial hyperplasia, abnormal bleed. Metformin 500 mg thrice daily for metabolic syndrome. Cystic hygroma, translucent swelling. Brachial cyst, cold abscess, not translucent. Cold abscess and of posterior triangle, immobile neck. Congenital torticollis, difficult labor. Quickly growing swelling, mostly malignant. Antifungal most likely to cause renal insufficiency. Amphotericin B. Aspergillus fumigatus, drug of choice. Voriconazole. Antifungal avoided in ventricle dysfunction. Itraconazole. Onychomycosis of two nails, drug of choice. Terbinafine. Dermatophytosis, scalp, drug of choice. Glycofulvin. Rosuvastatin, not given with clarithromycin. Mercedes-Benz sign with gallstone disease. Molar tooth appearance, Joubert syndrome. Popeye sign, rupture of biceps tendon. Bilateral diffuse reticular nodule of opacities. Pulmonary fibrosis. Acute dermatitis enteropathica, zinc deficiency. Niacin deficiency, pellagra. Systemic Joseph's nodule, stomach cancer. Garland sign, sarcoidosis. Multiple telangiectasias, Osler disease.